Please ensure this is the most updated version of this video. Check below in the video description for a link to a more updated version. If there is, please stop watching this video and proceed to that version. Greetings, this is a regularly updated video on COVID-19, hospital testing, precautions, and personal protective equipment. Topics to be covered in this video are how to order COVID PCR tests and isolation precautions in Epic, putting on or removing personal protective equipment for COVID patients, and aerosol generating procedures, otherwise known as AGP, for which you'll be using N95 and the Ppe hood. Ordering COVID PCR and isolation precautions in Epic. First, go into Epic, type SARS to access SARS-CoV-2 by PCR to order your PCR COVID test. Next screen takes you to here where it defaults to unit collect and nasopharyngeal swab. Next, you'll want to enter your patient precautions. Go to Patient Isolation Panel. Once that opens, click Contact and Droplet, hit Accept. Once testing and precautions are ordered, you will see COVID-19 rule out as well as contact and droplet on the left-hand side of your patient chart. Once COVID is confirmed, you'll see COVID-19 confirmed as well as contact and droplet precautions. Next, let's cover how to put on and remove your personal protective equipment for COVID patients. This includes rule-outs or confirmed. Before choosing your personal protective equipment, you must identify whether or not you're performing an aerosol-generating procedure. Aerosol-generating procedures are any procedure or event that causes the creation of smaller respiratory particles ranging from droplet to airborne and can greatly increase the risk for transmission of disease. If you're performing an AGP, do not use the regular mask or surgical mask. You will need to use an N95 or a Ppe hood in COVID patients. A regularly updated list of AGPs is below in the video description. Please take a moment to review this information at this time. Next, we will cover personal protective equipment, how to put it on properly and enter the room. This is in non-aerosol generating procedures. The instructions in this video are based on current CDC guidelines. Both putting on and removing personal protective equipment in the COVID patient follow this basic rule: hands, body, head, hands. That is, you start with your hands, you move to your body, you move to your head, and then back to your hands. Again, hands, body, head, hands. More specifically, for entering the room, you'll start by washing your hands, donning protective gear for the body, donning protective gear for the head, then gloving your hands and entering the room. First step is to ensure that you have all of your personal protective equipment ready outside of the room before you enter. This includes a face mask with your name on it, a bag with your name and the patient's room number on it, a gown, either disposable or reusable depending on your current hospital guidelines, a face mask, a pair of gloves, sanitizing wipes, any equipment you may need in the room including a disposable or non-disposable stethoscope, and additional gloves for when you exit the room. If you have long hair, please ensure that it is secure. If your hospital is currently changing masks before entering the room, please do this at this time. If not, please retain your current mask. Check with your hospital for current guidelines. We will now start our hands, body, head, hands method of putting on equipment. Start by washing your hands thoroughly. Then go to donning your gown. Again, either disposable or reusable, whichever is currently advised by your hospital administration. If you are using new masks in patient rooms, please place your new mask on at this time. Then go to placing your face shield over top of the mask. Then put on your gloves. If you are using a reusable gown, pull the elastic part of the gown forward, covering the base of your hand. Then pull the gloves over the top of the elastic part until they are covering it completely. Do not wash gloved hands any time when putting on or removing personal protective equipment. Washing gloved hands is an unnecessary step and can act to break down the glove itself. Once you are prepared, you can grab your equipment and then enter the patient room. After you have seen the patient, you are ready to remove your PPE and leave the room. If you have used a disposable stethoscope, leave this in the room with the patient. If you have used reusable equipment, please proceed to sanitizing this equipment with the proper wipes. Purple top wipes for anything aside from portable ultrasound probes. Use gray top wipes for this. Once this equipment is fully sanitized, please place it aside at least 6 feet away from the patient in a clean area. From here, removing your PPE is similar to putting it on, where the order is hands, body, head, hands. If you are using a disposable gown, you can remove the gown and gloves at the same time and put them into the wastebasket. If you are using a reusable gown, remove the gloves first, making sure to grab them from underneath, and then untie the gown and place it into the laundry bin inside the patient's room. Do not remove gowns or gloves outside of the patient's room. Wash or sanitize your hands inside the patient's room. You can then grab your clean equipment and exit the room. You will now don a new set of gloves that you can use to remove and sanitize your headgear. First, start by removing your face shield using the strap from the back of your head and clean it thoroughly using sanitizing wipes. If your hospital is reusing masks in each room to preserve PPE, remove this mask and put it in the bag with your name and the patient's room number on it outside of the room. Remove this last set of gloves and wash your hands thoroughly. Carts such as these, located outside of patient rooms, may either be storing employee PPE for reuse or PPE meant to be sent off for UV sanitization. Please ensure you are storing your equipment in the proper area. Next, we will cover personal protective equipment for aerosol generating procedures. The first decision you need to make is whether to use an N95 or a Ppe device. This decision is largely based upon whether or not you have a significant amount of facial hair along your chin line. Please refer to the CDC website for further guidance in this area. We will now cover how to properly don PPE using the N95 mask for aerosol generating procedures. If your hospital uses one-size-fits-all N95 masks like the one shown here, you may proceed. If not, you will need to be mask fitted before proceeding. Keep in mind that a mask fit test is not the same as a user seal check. Fit tests are performed occasionally and assure the right respirator choice for the person, the size, the characteristics of the respirator. A user seal check is performed every time and assures the respirator is working before you enter the room. You must perform a user seal check every time you use a respirator mask. To perform a user seal check, cover as much surface area of the mask as you can with your hands, ensuring not to push the mask into your face when doing so. To perform a positive pressure check, exhale gently into the mask until it bulges out. Make sure that no air has escaped around the edges when doing so. To perform a negative pressure check, inhale more forcefully until the mask collapses, ensuring again that no air has escaped around the edges of the mask into the mask itself. If any air has escaped in or out of the mask during this user seal check, you may need to adjust the mask. If continued adjustments do not work, you may need to switch to a Ppe device. Please see below in the video's description for a complete instructional video from OSHA on how to perform a user seal test. Similar to before, we have the same order of operations. We start with our hands, move to our body, our head, and back to our hands. More specifically, we wash our hands first, we don our gown, we don our N95, then our face shield, and then we put on our gloves before entering the patient room. Before proceeding, you must ensure that all of your PPE is ready to go. This includes a gown, either disposable or reusable based on current hospital protocols, a face shield with your name on it, a bag with your name and the patient's room number on it, an N95 mask that has either been UV sterilized for reuse in the patient's room or a brand new one depending on current hospital protocols, a pair of gloves, and any other equipment you may need, including a disposable or reusable stethoscope. Please also ensure that there are sanitizing wipes and additional gloves outside the room for when you exit. If you have long hair, please ensure that it is secure at this time. If you are currently wearing a mask, remove the mask at this time and set it aside. We will now start our hands, body, head, hands method of putting on equipment. Start by washing your hands thoroughly. Then go to donning your gown, again either disposable or reusable, whichever is currently advised by your hospital administration. Place the N95 respirator on your face, one strap above and below your ears. Press around the N95 mask until you have a good seal. Now is the time to perform your user seal check with positive and negative pressure checks. If you do not achieve a good seal, you may need to switch to a Ppe device. Put your face shield on over the N95, then put on your gloves. If you are using a reusable gown, pull the elastic part of the gown forward covering the base of your hand, then pull the gloves over the top of the elastic part until they are covering it completely. And just as before, do not wash gloved hands at any point in this N95 protocol. Grab any equipment you may need and enter the patient room. After you are done seeing the patient, you will need to remove your PPE properly. If you have used a disposable stethoscope, please remove it and leave it in the patient's room at this time. If you have used your own equipment, wipe it down thoroughly with the sanitizing wipes and place it at least 6 feet away from the patient in a clean area. Similar to before, the order of taking off your PPE is hands, body, head, hands. If you are using a disposable gown, you can take off your gown and gloves simultaneously, removing the gloves from underneath and placing them to the trash can inside of the patient's room. If you are using a reusable gown, you will start by removing the gloves from underneath, placing them into the trash can, and then placing the reusable gown in the laundry bin. Wash or sanitize your hands inside the room. You may then grab your clean equipment and exit the room. Put on a second set of gloves so that you can remove and sanitize your equipment. Remove your face shield using the strap from the back of your head and wipe it down thoroughly with sanitizing wipes. Remove your N95 by using the straps from the back of your head and placing it carefully inside of the bag labeled with your name and the patient's room number. Remove your last set of gloves and wash your hands thoroughly. If your hospital is preserving any of this PPE, including the N95 mask by UV sterilization, please ensure it is labeled properly and put into the appropriate area. We will now cover how to use the Ppe device, which again is only to be used in aerosol generating procedures in the COVID patient. Before using a Ppe device, you must ensure that it is working properly. You'll first want to ensure that the Ppe device powers up properly by pressing the power button on the left-hand side. All lights should light up green, including the battery and fan. If the device is powered up properly, you'll next want to test the amount of positive pressure by placing the measurement tool on the end of the hose. If the ball floats to the very top of the device, you have adequate positive pressure. This measurement device comes with an attached instructional card for proper use in colder temperatures. Next, you'll want to ensure that your hood attaches properly to the unit. Attach your hood, ensure that air is flowing, and then go ahead and power down the unit. If the unit does not power up properly or is showing a low battery, remove the battery by pushing the button on the side and replacing it with a fresh battery from the charging stations located on many floors in the hospital. Replace the battery and power up the unit to ensure it's working properly. Now we will cover how to put on the Ppe and accompanying PPE before entering the room. Similar to all other COVID PPE protocols, the order is hands, body, head, hands, specifically washing your hands, placing the Ppe belt, placing the gown, placing the hood, and then gloving your hands. Before proceeding, you must ensure that all of your PPE is ready to go. This includes a gown, either disposable or reusable based on current hospital protocol, a pair of gloves, and any other equipment you may need, including a disposable or reusable stethoscope. Please also ensure that there are sanitizing wipes and additional gloves outside the room for when you exit. your Ppe device already checked out and ready to go, and your Ppe hood that you can get from Central Supply. If you have long hair, please ensure that it is secure at this time. Wash your hands and then power up the Ppe device. Once the Ppe device is properly powered up, you will place it around your waist with the Ppe unit in the back. You can clasp the straps in the front and then adjust the tightness to comfort. Place your gown on over the top of your Ppe unit and tie it down securely. Grab your hood and attach it to the Ppe hose hanging off of your back. Once it's attached, place the Ppe hood on top of your head and work to ensure a good seal from ear to ear with the elastic strap running around your chin. Ensure that positive pressure is present and that air is flowing inside of the unit. The hose should run from the back of your head down your back to the Ppe unit located at the base of your back. Then put on your gloves, and again, if you are using a reusable gown, ensure that the gloves are covering the elastic part at the end of the sleeve. As with all other COVID protocols in this video, washing gloved hands is not recommended in the Ppe protocol. Once you are ready, grab your equipment and you may enter the room. Once you are done seeing your patient, the first step, as usual, is to leave a stethoscope inside the room if it is disposable, and then wash stethoscopes or any other equipment you've brought into the room with sanitizing wipes. Set them aside 6 feet from the patient in a clean area. The order to removing Ppe gear is similar to putting it on: hands, body, head, hands. You can start by removing your gown and your gloves simultaneously and placing them into the waste bin inside of the patient's room. For reusable gowns, you start by removing your gloves, grabbing the gloves from underneath, placing them in the waistband, and then placing your reusable gown inside the laundry bin. Wash or sanitize your hands thoroughly, grab your clean equipment, and exit the room. Outside the room, you will don a second set of gloves to remove and sanitize your equipment. Start by detaching the hood from the Ppe unit itself, remove the hood from the back, similar to the face shields, and then wash the hood thoroughly using sanitizing wipes. This hood will be yours for use in multiple patient rooms, so please ensure that you sanitize it thoroughly before setting it aside. Next, you can remove the Ppe and clean it thoroughly using sanitizing wipes. Ensure that you have not missed any spots on the Ppe before you put it away for future use. Remove your last set of gloves, wash your hands, and then store your hood for future use. Please remember that this protocol is subject to change at any time and can be based on the availability of personal protective equipment. Check your hospital email regularly for updates. And again, if there is a link to a more updated video in the video description below, please proceed to that version and disregard this video's contents.